problem statement is when a person eats a lot of unhealthy food such as fast food that high in cholesterol and sugar will cause coronary artery disease, or we call it CAD. Coronary artery disease is narrowing or blockage of your coronary arteries, usually caused by the build-up of fatty material called plaque. Coronary artery disease is also called coronary heart disease, ischemic heart disease, and heart disease. Coronary artery disease is caused by the atherosclerosis. Atherosclerosis is the build-up of plaque inside your arteries. Plaque consists of cholesterol, fatty substances, waste products, calcium, and the clot-making substance fibrin. As plaque continues to collect on your artery walls, your arteries narrow and stiffen. Plaque can clog or damage your arteries, which limits or stops blood flow to your heart muscles. If your heart does not get enough blood, it can't get the oxygen and nutrients it needs to work properly. This condition is called ischemia. Not getting enough blood supply to your heart muscles can lead to chest discomfort or chest pain. It also puts you at risk for a heart attack.
Hello and Assalamualaikum. My name is Muhammad FIRDAUS bin ROSLI and my matric number is J20B0508 and subject is AMT 2082 Biomaterial Resources Season 2021 and 2022, and our lecture name is Dr. Hakimin. So today I'm going to talk about solution of polymer stent to prevent of risk in medical field. So what is the risk will be happen when we using polymer stent? So this is a list of risk will be happen. The risk happen depend on age. If the patient is a young, the risk unlikely be happen to them. If a patient is a old in all year, like old man or old woman, this risk will be happen to them, such as excessive bleeding. This example of my list, heart attack and stroke. So how we going to prevent this risk? So this figure show a various method using to prevent the risk. This is a list and a figure many material to for polymer stent to prevent risk, such as polymer coating, submaterial, delivery system, duct and vermiculus. So for example, polymer straight stabilization of stent. The polymer stent will be coated using a drug, some material, and for polymer. Example, polymer straight stabilization of stent with PPLGPEG significantly reduce neonatal hyperplasia in Polymer resource model, reduction of cell stent interaction mediated by PLG appear to improve biocompatibility of stainless steel without evidence of adverse inflammatory or fibrotic effect. Another example is drug elatin stent, that short form is DES. Drug elatin stent reduce clinically and angiographic resistance compared to bare materials stent BMS. The polymer coating on the anti-porphyrias drug to inhibit intermittent proliferation and prevent retosis after stent implantation. So for the last is even with the material we use to prevent the patient getting the risk, but patient also need cooperate with the doctor when the doctor tell them to do so. So after surgery and inflammation of stent polymer, the patient need to avoid doing standard tendinous activity, driving and heavy lifting at least a week. If muscle strength, the blood vessel will expand along with the muscle and will lead to injury inside the patient body. So this is my last of the slide. Thank you for listening.
Assalamualaikum and hi, my name is SYAKIRAH binti AZMAN. My matric number is J20805558. Today I would like to present about explanation of polymer stent. Do you want to know about polymer stent? Let me explain with you. Polymer stent, a pump with quick application in cardiology, in particular in coronary vascular interpretation, a stent platform, and continuometry for drug-electing stent. Apart from permanent polymers, current research is focused on biodegradable polymers. What are polymer stents made of? The degradable stents are made from a polymer called polylactic acid or PLLA, which is also used in dissolvable sutures. Why polymer used in stent? This primarily biostable polymer bind the drug to the stent and modulate the elution of the drug into the arterial tissue. That is all about explanation of stent by me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul binti AMINUDDIN J20A0604. So I will explain about pose of stents.
First, the use of biodegradable polymers opposed to durable polymers in coronary stent technology has the advantage of complete elution of drugs, also reduced inflammatory response with the potential for decreasing the risk of late complications such as stent store uncovering, malabsorption, endothelial dysfunction, and thrombosis. Second, aggressively lowering your low-density lipoprotein (LDL) cholesterol, the bad cholesterol, and can slow, stop, or even reverse the buildup of fatty deposit in your arteries. Statins are commonly prescribed to lower cholesterol, improve artery health, and prevent atherosclerosis. Then, drug-electing coronary stent can help prevent plaque buildup, promote good blood flow to your heart, and relieve chest pain. They may also lower your chance of having a heart attack. After that, it can substantially improve your blood flow and prevent further damage to your heart muscle. It can also improve symptoms of heart disease, such as chest pain and shortness of breath. In many cases, you will feel the benefits immediately. Growth of stents also allows treatment of in-stent restenosis without permanent additional metal layer. And lastly, reduction in the amount of dual antiplatelet therapy. So that's all from my part.
Hi everyone, my name is DANABALAN. My metric card number is J20B0740. Today, I am going to present about cons of stent. Firstly, is the narrowing of your artery. When angioplasty is combined with drug-eluting stent placement, there's a small risk the treated artery will become clogged again. The risk of re-narrowing of the artery is higher when bare metal stents are used. Next is the blood clots. Blood clots can form between stents even after the procedure. These clots can close the artery, causing a heart attack. It's important to take aspirin in combination with clopidogrel, prasugrel, or another medication that helps reduce the risk of blood clots, exactly as prescribed to decrease the chance of clots forming in your stent. Final one is the bleeding. You may have bleeding in your leg or arm where a catheter was inserted. Usually this simply results in a bruise, but sometimes serious bleeding occurs and may require a blood transfusion or surgical procedures. That's all from me. Thank you. Next, I'll pass to my friend.
Assalamualaikum and a very good day to my fellow lecturer and my friends. My name is NABILAH binti ADNAN. My matrix number J20A0530. Today I would like to tell you guys about side effects of stent. Any surgical treatment entails some level of risk. The placement of a stent may necessitate the use of arteries in the heart or brain. As a result, there's a higher chance of negative consequences. The following are some of the dangers connected with stenting: the artery being re-narrowed, a heart attack, kidney stones caused by an infection of the artery caused by the use of a stent in the ureters, an adverse reaction to the procedures, medicines, or dyes, anesthesia, or the use of a stent in the bronchi might cause breathing issues, artery obstruction, and blood clots. The last one is strokes and convulsions are two uncommon side effects. That's all for me. Thank you.
Hello. Hello, my name is HISAMMUDDIN bin Hassan Buseri. My metric number is J2080665. Today, I'm gonna talk about another application of polymer stents. As we know, the polymer stent has many use and its application, especially in cardiovascular disease. Other than that, the polymer stent also used in blood cells. During injury, polymer implantation initiates an inflammatory response, resulting in adhesion and extravasation of polymononuclear glycosides to the implant sites. Blood cells into the material. In this regard, Goldman and Lawrence introduced the definition of critical velocity applying. Assumption the interaction between adhesion and take place will move with 70% of the velocity of free moving deposit with the same distance. Other than that, this polymer stent also used to deal any obstruction caused by gastrointestinal. This study is efficacy and safety for human being and must be continued in near future. Okay, that's all for now today. Thank you.